It was scenes like these the ACT government was keen to avoid. For days, thousands of protesters swarmed Victoria's streets and the steps of Parliament, opposing a pandemic bill they said bestowed too much power on the Premier with too little oversight. A watered-down version of the Victorian laws passed this afternoon, just hours after the ACT Health Minister tabled her own bill.
So this new part of the Public Health Act that we're proposing would enable us to step down from an emergency but continue those baseline measures to protect the community from the ongoing threat of COVID-19.
Once enacted, the power to impose a lockdown will end, along with the power to shut down businesses. But the government could still mandate mask wearing and vaccination, and it will still be able to restrict social gatherings and enforce density limits.
All of those require the advice of the Chief Health Officer and really reflect our ongoing commitment to taking the public health advice.
The Human Rights Commissioner must also be consulted every step of the way.
I think it's been central all the way through, but it's not been an express requirement. The government's done it as a gesture of goodwill, but having it in black and white in legislation is much more powerful.
The power to declare a public health emergency won't disappear, so lockdowns and shutdowns will remain an option should the government decide they're necessary. But this new set of laws allows a different approach, one that is less restrictive and clearly sets out what COVID normal in Canberra will look like. The opposition and the ACT Law Society have criticised the lack of consultation, especially in light of the difficulty that surrounded Victoria's bill.
We understand that there has been no consultation with the broader community or legal experts, and we do have some serious concerns about that.
The bill has been referred for a committee inquiry, an important step that will give experts and the community the chance to have their say before the legislation is debated in March. Rosie King, ABC News, Canberra.